Why is accurate bladder cancer typing critical for treatment? Imagine trying to fix a problem without knowing exactly what it is. That's why accurately identifying the type of bladder cancer is so important. Bladder cancer is not just one disease but a group of different conditions that vary in how they grow and respond to treatment. Knowing the specific type helps doctors choose the right approach and gives patients a clearer picture of what to expect. Bladder cancer is classified mainly by how deeply it has invaded the bladder wall and by the characteristics of the cancer cells. The first major category is non-muscle-invasive bladder cancer. These cancers are confined to the inner layers of the bladder and have not reached the muscle layer. They include stages called TA, TIS, and T1. Treatment for these usually involves a procedure called transurethral resection of the bladder tumor, or TURBI, which removes the tumor through the urethra. Afterward, doctors often recommend intravesical therapy, such as chemotherapy or immunotherapy with Bacillus calmette-guerin, to reduce the risk of recurrence. Accurately identifying this type helps determine whether the cancer is likely to come back or progress, guiding whether to monitor closely or consider additional treatments. The second main type is muscle-invasive bladder cancer. These cancers have penetrated the muscle layer of the bladder wall or beyond. Treatment here is more aggressive and often involves removing the bladder entirely through a surgery called radical cystectomy. Patients may also receive systemic chemotherapy, usually with drugs like cisplatin or radiation therapy. Correctly diagnosing muscle invasion is crucial because it shifts the treatment from local procedures to systemic and surgical options. Missing this invasion could mean less effective treatment and worse outcomes. Beyond how deep the cancer has grown, bladder cancer typing also includes the specific kind of cancer cells involved. The most common is urothelial carcinoma, but other types like squamous cell carcinoma or adenocarcinoma can occur. These subtypes can influence treatment choices, especially as new targeted therapies and immunotherapies become available. Getting the type right is vital for several reasons. First, it helps doctors select the most appropriate treatment. For example, a patient with non-muscle-invasive cancer might avoid unnecessary surgery, while someone with muscle-invasive disease needs more aggressive treatment. Second, accurate typing allows for better risk assessment. It helps predict whether the cancer might come back or become more serious, which influences how often patients need follow-up scans and tests. Third, knowing the exact type and stage helps estimate prognosis, so patients can understand their outlook and plan accordingly. Accurate bladder cancer typing also opens doors to clinical trials and new therapies. Many experimental treatments are designed for specific cancer subtypes or molecular profiles, so correct classification ensures patients can access the latest options. Lastly, proper diagnosis prevents unnecessary procedures that could harm quality of life. For instance, avoiding radical surgery in low-risk cases preserves bladder function and reduces side effects. In summary, precise bladder cancer typing is the foundation of personalized care. It ensures patients receive the most effective, safe, and appropriate treatments based on their cancer's specific characteristics. This approach not only improves outcomes but also helps maintain quality of life. Always remember, if you or someone you know faces bladder cancer, consulting healthcare professionals for accurate diagnosis and tailored treatment plans is essential.